Hello and welcome back to Ask Dr. Moore. In keeping with the sports theme, we're going to continue on with some popular FAQs or frequently asked questions. How do doctors check for a sprained ankle? And it's quite simple. There are a few maneuvers and of course a few structures that we check with an x-ray in the office for a first visit. If you need an MRI or not, we can rule in or rule out a few things, and these are things you need to look for. So for example, the outside ankle, which is the common sprain inwards, where you tweak the foot inwards, there's the ATF, anterior talofibular, there's the CF, the calcaneal fibular, and of course the PTF, which is the posterior talofibular. There's three ligaments, they kind of form in front. The most common one here, we can test with the anterior drawer test. And if you put your hand on the front of the shin and the back of the heel and you pull forward and you pull the foot forward like this, if it's tight, that's a negative anterior drawer, but if it does pull forward, most likely you have a partial tear or a complete tear of the anterior talofibular ligament and possibly the CF or calcaneal fibular. The inside is the deltoid ligament. That's usually from an eversion sprain. There's not a real definitive maneuver with the exception of just pulling the foot inwards. The patient experiences pain or tenderness on this area. You can't really rule out a tear. Other things you need to look for is the fifth metatarsal base here on the outside of the foot. The peroneal tendon it connects there, and with an inversion sprain, that tendon can pull, tear itself, or even pull a piece of bone off or fracture further down, which is your classic Jones fracture. You want to check for that. And then on the inside, there's the posterior tibial tendon that comes underneath the ankle joint that connects here to the navicular. So those are the main ligaments and tendons to look for in an ankle sprain. Of course, if it's a really bad injury, you want to check for the Achilles too. But patients are having different complaints where they can't continue to walk through. Of course, there's radiating pain in the back of the ankle and the calf area. Again, those are high up where the muscle inserts in the tendon itself, and an attachment back here. The Thompson's test for that one is squeezing the calf. So if the patient's laying on the floor this way and you squeeze the calf and the foot moves, that's a negative. And if you squeeze it and nothing happens because the Achilles tendon is torn, that's a positive Thompson test. Again, hopefully that helped out a little bit with your pre-diagnosis when you've tweaked your ankle on the basketball court or the football field and you're out in the middle of nowhere. Otherwise, if you want to watch some more videos, you can tune into my channel, which is Dr. Robert J. Moore III. You can see surgical videos or Ask Dr. Moore videos on its own individual Ask Dr. Moore channel. If you don't like those and you want to ask your own question, place it in the comments area and I'll do my best to get to that and answer your personal question here on that channel.